Tonight, spray trucks are working in unincorporated parts of Tarrant County and in Frisco in Collin County. We learned just hours ago that 28 North Texans have died. More than 900 have fallen ill, and we are still weeks from the end of mosquito season.
Tonight, team coverage of the West Nile virus, from a new support group for patients to serious questions about prevention. And that's where we begin with an NBC 5 investigation. Investigative reporter Scott Friedman first showed you how Dallas doesn't have the plans or the people to battle the disease as aggressively as some cities. And tonight he is here with some more missed opportunities. Scott, what'd you find?
Well, Meredith and Brian, we found in the months leading up to this crisis, the budget for fighting West Nile was so small, Dallas wasn't doing some of the things experts recommend. And as you're about to see, the city and county may have to consider new ways to fund their efforts if they want to prevent another outbreak. One way to spot West Nile before it reaches humans is to follow a trail of birds. The birds really give you an earlier window into what's going on because it's going to go from the birds to the mosquitoes to the people.
Since it's a bird disease, yes.
David Brown runs one of the country's best programs to combat West Nile. NBC 5 Investigates went to Sacramento, California to see how they do it. To pinpoint the virus early, they pick up dead birds and test them. So testing dead birds can give you an earlier warning system.
That's right. Very frequently, they're some of the earliest indications of virus activity we see.
But in Dallas, in the months leading up to the West Nile epidemic, the city did not test dead birds. The Texas State Department of Health doesn't even accept them for testing anymore. They used to send them to a lab in Wisconsin and say it was taking too much time to get results. So if a city's not testing dead birds, are they missing an opportunity?
I think so, but that's another program that's going to cost.
Sacramento has a lot more money, a $10 million yearly budget for a mosquito control district funded by property taxes, with 70 employees covering a 2-county area. Dallas County and the city of Dallas have just 4 employees each dedicated to mosquito control. Sacramento runs hundreds of mosquito traps a week, testing them and quickly treating spots where the virus is found. Last week, we showed how the city of Dallas runs far fewer traps per square mile than cities like Sacramento and Houston with more aggressive plans. And this year, Dallas didn't start trapping mosquitoes until May, later than some experts recommend. So having more traps really gives you better, more specific information about where the source of the problem is.
That's right, for sure. And if money were unlimited, we'd love to have lots of traps, even more than we have here in California.
Dallas County and city leaders tell us they're now re-examining the plan.
And we're going to look at every aspect of it, the amount of traps, organizationally, timing, communication. It's not just one aspect, it's the whole kit and caboodle that needs to be looked at very closely.
My daughter thought I was possibly having a stroke.
Sandy Flora caught West Nile in Dallas in July, suffering neurological damage. Today, she wants the city to do more to keep others from being bitten.
I would tell them in the future, they really need to start checking sooner, and they need to just get out there and spray.
In Sacramento, they search for water sources where mosquitoes breed. They find abandoned swimming pools and stock them with fish that eat mosquito larvae. They use aerial spraying before human cases arise and larvicide to stop mosquitoes from growing. To get this level of service, it costs the average taxpayer $15 to $20 a year, about the same price as a few bottles of mosquito repellent. By having a dedicated budget, it stops the temptation to cut funding that can happen when West Nile cases drop or when health departments have competing priorities.
They got flu, they have STDs, they got endless things to deal with, and often mosquitoes, if there's not a big disease situation, they're not high on the radar screen.
Records we uncovered show in recent years, Dallas County's health department rarely bought any larvicide to prevent mosquitoes from growing. This year, the county bought no larvicide until July 30th, days after the CDC told the health department Dallas was already at the highest possible risk level. Records show no larvicide bought in 2010 or 2011 either. County Health Commissioner Zach Thompson would not talk to us on camera, but told us in an email there was no need to purchase additional adulticide or larvicide in 2010 and 11, mild years for West Nile. But experts tell us staying aggressive in quiet times can help avoid outbreaks.
I always think you want to try to have that program in place so that you can try to intervene at the earliest possible moment, and certainly larviciding is one of the best ways of doing that.
Dallas County Judge Clay Jenkins tells us the health department responded appropriately with the tools it had. They're now studying how to make the program better.
We're always looking to take the best ideas as we move forward to further the public good.
And Jenkins says he's willing to consider creating a Dallas mosquito control district.
I think that's certainly one of the options that will be discussed in the future. We've got a public health committee that has input from all 31 of the cities here, and they've got to be a part of that discussion.
Do we need a mosquito control district here?
Well, I'm not going to take anything off the table. I'm not into taxing people to take care of their mosquitoes. That doesn't sound like a good idea to me.
To Sandy Flora, still suffering from West Nile, the extra cost would be worth it.
It is a shame. It's just a shame that that things weren't done sooner, not only for myself, but for all these other people.
The Houston area already has a mosquito control district. It also has a staff of about 70 people. They set up their own program to test dead birds. They're more aggressive about aerial spraying. The question here, Brian and Meredith, really is how much more are people willing to spend if they really want better protection?
All right, really interesting information. All right, thanks, Scott.
Yeah.
And Scott's investigation is getting a lot of attention. In Irving, the city council actually watched our report at their last meeting.
This piece was done by Channel 5, and we're going to go ahead and play it, and after that we'll do some comparisons to the programs that they mentioned.
After seeing our report, Irving's considering testing mosquitoes earlier in the season. They already run more traps per square mile than Dallas. The Irving city manager praised our report, saying it covered angles that really had not been covered since the epidemic started.